what is healthcare and what is medical care? What is healthcare and what is medical care? Any idea? Medical care is nothing but the care rendered by health professionals or the services provided to the community under the guidance of the health professional. That means the persons who are coming at the hospital for various ailments and doctors are prescribing drugs or various maneuvers to have a improvement in the health status. That is the health, that is the medical care. And what is health care? Health care includes not only medical care but also other services like facilities of safe drinking water. One thing, if you want to go on talking, it is not possible for me to continue my class. You have every liberty to leave the room, but if you go on disturbing me, it is not possible to continue my class. So, healthcare is not only the medical care, but also the other services which are needed for good health, like safe drinking water, sanitary facilities, provision of nutritious diet. So, other allied departments like food and agriculture, animal husbandry, public health engineering departments. So, these departments will provide other services which are essential for good health. Clear? So, medical care is a subset of health care. Health care is a broad term and every citizen of our country have the right to have the good health, and it is the mainly the responsibility of the state government to give the health care of every citizen of its state. Clear? What is health care and what is medical care? Medical care means care that is advised by the physician or the services which are provided to them under the guidance of the physician. But medical care, health care means not only the medical care but also the other services like having the facilities of safe drinking water. Why? Importance of safe drinking water? Because if we do not have safe drinking water, we may develop various waterborne diseases like diarrhea, cholera, poliomyelitis, gastroenteritis, giardiasis, MBBS. So, these are the various waterborne diseases which can be prevented by supply of safe drinking water, and also the other sanitary facilities. Why sanitary facilities is so important? Because if we do not have the sanitary latrine, then we may contract various communicable diseases like typhoid, diarrhea and other waterborne diseases, giardiasis, MBBS. So, basic sanitation is also equally important, and also the supply of proper food, nutritious food. Why? If we do not get adequate nutritious food, we may develop various types of undernutrition. It may be low birth weight, or it may be stunting, or it may be wasting. So, if a child is malnourished, there is every possibility of developing various communicable diseases because there is immunosuppression. In case of malnourished children, there is immune suppression in compared to a normal healthy child. That is why the nutritious diet is also equally important. So, health care means not only the medical care but also the other services which help us to have a good health. Clear? What is the difference between medical care and health care? Now, health care of the community. Health care of the community is to be provided by our government through various ways. One is by establishment of primary health center and sub-centers. Establishment of primary health center and sub-center. And this healthcare is provided at 3 levels. At primary level of care, secondary level of care, and tertiary level of care. All the medical colleges and regional hospitals, they provide tertiary level of care. Here, at tertiary level of care, mainly the sophisticated treatment and also complicated cases are dealt with at tertiary care level. Apart from this, facilities for training. We are being trained so that after 4 or 5 years, you can get the MBBS degree. So, training and also the research activities. So, these are the services which are provided at tertiary level of care, mainly at the hospitals and medical colleges and also the regional hospitals. Next is secondary level of care. Secondary level of care means district hospital, sub-divisional hospital, district hospital, sub-divisional hospital. At this level, complicated cases which are referred from the primary level of care, these complicated cases are treated at district hospital and the sub-divisional hospital level. That is the secondary level of care. What is primary level of care? Primary level of care, the services provided at sub-central level and also at PHC level. PHC means primary health center. Primary health center, here medical officer is posted and also other staffs like nursing staff, group D staffs, clerical staffs are there. So, they provide medical services and also other services. And at sub-center, it caters to a population of 5,000 to 6,000. For every 5,000 population, one sub-center is located. At sub-center, there is no medical officer. There is no medical officer. এখানে কোনো medical officer থাকে না। কারা থাকে? NM and health worker male. Health worker male. NM, auxiliary nurse midwife and health worker male at sub-central level. What are the services at sub-central level? At sub-central level, they provide immunization to under 5 children. They give tetanus toxoid injection to the pregnant women and also they do antenatal checkup and they screen the pregnant women and the complicated cases are referred to the higher center. At PHC level, medical officer not only treats the common diseases and injuries, but he also gives training to the ANM. PHC medical officer gives training to ANM, health worker male and also the Anganwadi worker. And also the DICE, DIMA. So, medical officer gives training and also the supervisor. Medical officer gives training as and when necessary to the supervisor, DICE, Anganwadi worker, ANM, and also the health worker male. So, medical officer not only treats the patient but also gives training for various health programs as and when necessary. And he also gives emphasis on immunization of under 5 children, immunization of under 5 children. And he also looks after the administration of primary health center, and he also reports to the higher center if there is any outbreak, reports to the higher center so as to prevent further spread of the disease. Reports to the higher center means he reports to CMH, Chief Medical Officer of Health. Chief Medical Officer of Health, office of CMH is located in the district Sadar, and he informs the CMH that there is outbreak in my PSC. So, the CMH guides his supportive staffs to give necessary assistance to the PSC. Clear? So, these are the primary level of care. At primary level of care, mainly the preventive care. At primary level of care, mainly the preventive care, preventive and promotive care. And secondary level of care, it is a mix of both preventive, promotive and curative care. And at tertiary level, mainly the complicated cases are mostly dealt with. There is training, there is research programs. So, these are the activities of tertiary level of care. Next is, what is the definition of primary health care? It is very, very important. Almost in every alternate year, you will get this type of question. What is primary health care? What are the principles of primary health care? And what are the elements of primary health care? What are the principles of primary health care and what are the elements of primary health care? I am coming one by one. What is the primary health care? What is the definition? Primary health care is an essential health care made universally available to all individuals, and it is acceptable to them at a cost the community and country can provide. So, primary health care is an essential health care made, primary health care is an essential health care made universally available and acceptable to them through their full participation and at a cost the country, the community and country can afford. এই 3-4 লাইন you must commit it to your memory, you must memorize. Now, what are the inner meanings of essential health care? Essential health care means the care which are to be provided to all, irrespective of their ability to pay. So, one is essential health care. Next is acceptability. This care must be acceptable to all. All people must accept this care and it must be affordable. That means these services are to be provided to all of the community people, irrespective of their ability to pay. So, government will render these services free of cost. Clear? So, primary health care is an essential health care made universally available to all individuals and acceptable to them through their full participation. Full participation means community people must be involved for taking this primary health care. So, full participation of the community with the capacity to pay for this. So, primary health care is an essential health care made universally available and acceptable to them through their full participation and at a cost the community and country can provide. Suppose if we construct various costly hospitals and these costly hospitals will treat a say diarrhea patient and at the end of 2 or 3 days you will be handed over a bill amounting to rupees say 2 lakhs. So, is it possible for common rural people to pay 2 lakhs for treatment of diarrhea? It is not possible. So, costly hospitals, costly equipments are mostly located in the towns where only one-third people of our country reside. 3/4 of our country people reside in the rural areas and they have no capacity to pay huge amount for treatment purpose. That's why it is the responsibility of the government to provide primary health care, essential health care to all of the community irrespective of their ability to pay. Clear? So, what are the principles of primary health care? What are the principles? One is equitable distribution. What is the difference between equal distribution and equitable distribution? Equal distribution means, suppose I have got a lottery of 1 lakh and I am equally distributing among you. That is equal distribution. কেউ 10 টাকা পেলো, কেউ 5 টাকা পেলো, এরকম না. Equally distributed among the people. That is equal distribution. What is equitable distribution? Equitable distribution means the health services are to be provided to all people in our country irrespective of their ability to pay. There will be no difference among the rich and poor, among the elite group and among the poor society. So, these services are to be provided to all irrespective of their ability to pay. I am giving just one example. On every Wednesday, Government of India is giving immunization services to all under 5 children free of cost. Free of cost, all mothers are getting their child immunized against major infectious diseases. BCG, DPT, pentavalent, rotavirus vaccine, JE vaccine, polio vaccine. So, all these vaccines are provided free of cost to all under 5 children. So, it is the policy of the government to protect the health of the children because they will be the future generation and they will be the earning members. So, if they suffers from various diseases, suppose if a child suffers from poliomyelitis, what will be the fate? The child may die or may not die, but if he or she survives, he may have some complication, partial paralysis. So, he will not be able to lead a socially productive life. He will be the burden of our country. That's why Government of India has taken this initiative. That means primary health care. That means all essential services are to be provided to all people of our country, and these services are to be acceptable to them, and these services are to be provided free of cost, and government will be able to provide these services to all of our citizens. And equitable distribution and equal distribution, is there any confusion? What is that meaning? What is the difference between equitable and equal? Equal means equal distribution, but equitable means all the services are to be provided among all categories of people irrespective of their ability to pay. Rather, these services are to be directed towards the rural belt who are more in need. These services are to be provided more to them who are more in need. Clear? That is equal distribution. Next is, এই সাদা চক দিলে না বাবা? Community participation. In the exam, open you are asked, give an example of community participation. Community participation means community people are to be involved to deliver the health services. One best example is ASA, involvement of ASA. ASA means accredited social health activist. Accredited means they are recognized, তাদেরকে স্বীকৃতি দেওয়া হয়েছে. Accredited social health activist. How will you identify that this woman is a ASA worker? They wear violet color sari. They wear violet color sari. House to house visit করে দেখেছো? So these ASA workers are selected from the community. They must have the degree of class 8 pass. Nowadays madhyamik pass, and they are selected from the local community. No outsider will be selected. Why? Because ASA workers are more acceptable to the community. আরে আমাদের গ্রামের দিদিমণি এসছে, দিদিমণি বলছে ডায়রিয়া প্রিভেন্ট করতে গেলে আমাকে পরিশুদ্ধ পানীয় জল খেতে হবে, সেফ ড্রিঙ্কিং ওয়াটার খেতে হবে। তাহলে সেফ ড্রিঙ্কিং ওয়াটার কিভাবে পাবে? আইদার from deep well or the drinking water provided by the panchayats. And also, if a child suffers from diarrhea, give water solution frequently, and also they distribute antidiarrheal drugs. So community people will respect the ASA and they will follow her advice. Clear? So ASA is an example of community participation. ASA will motivate the mothers that you must get your child immunized, and this immunization will help you for maintaining good health of your child. Because if your child suffers from poliomyelitis, then he may not recover fully. If a child suffers from rotavirus, then the child will develop frequent loose stool. So rotavirus is in 50% cases, diarrhea cases, rotavirus is responsible for diarrhea among the under 5 children. That's why rotavirus vaccination, oral drops in the form of vaccination was given to the children. So ASA participation of ASA worker is very important. write short notes on ASA, roles and responsibilities of ASA. 10 or 11 points are there. One important point is motivation of the mothers to get the child immunized. And she also gives advice, various health advice. Next is social intersectoral coordination. Intersectoral coordination. Intersectoral coordination. I have already told you that other departments should come forward for upliftment of the health of the community. Other department means public health engineering department, animal husbandry department, agriculture department. So, government should take initiative so as to plan or formulate policies for improvement of the health, because there is lack of coordination among various departments. So, it is the politicians who can take steps so that the all allied departments will work together so as to improve the health condition of the community. So, that is intersectoral coordination. One example is public private partnership. देखो ना, hospital है, costly equipments were installed in the hospital, but the trained manpower is shortage in the government sector. So, public sector from the public sector or from the not public, from the private sector, they will hire the trained doctors, first specially trained to handle this costly equipment. So, under the public private partnership, various sophisticated investigations are going on and public is getting its benefit. Next is appropriate technology. Appropriate technology, best example is ORS packet, ORS powder. Why? In case of appropriate technology, this ORS is scientifically sound. That means it has scientifically proved that if we administer ORS solution to a child who is suffering from diarrhea, in 99% cases, there is no need of giving intravenous transfusion of ring lactate or normal saline. So, in 99% cases, the child will recover completely. So, it is scientifically sound. Next is, it is cheaper. It is cheaper. It costs hardly 20 rupees. So, the common people will pay for that. He can spend 20 rupees for purchasing this ORS solution if the child suffers from diarrhea. Government supplies this ORS packet through ASA worker and also through the Anganwadi worker. But if there is a shortage of ORS solution, the common people can purchase if they need it. So, it is one important point is appropriate technology means the technology which will be scientifically sound, it will be cheaper and it will be acceptable. Community people must accept this ORS. It will be acceptable to the community and it will be acceptable to the provider who are supplying these ORS packets. That means the ASA workers are conversant with this ORS powder, how to prepare ORS packet, and community people will also accept that yes, this ORS solution is beneficial for us in case of diarrhea. So it should be acceptable to the provider, and it will also be acceptable to the services, to the workers who are providing this service to the community, and it will be at low cost, so that the community people can purchase this ORS solution by paying hardly 15 or 20 rupees. So it is the best example of appropriate technology. Another appropriate technology is Sulabh Sauchalaya. Sulabh Sauchalaya. Any people will pay rupees 5 or 10 if they need any assistance at the time of urination or at the time of defecation. So Sulabh Sauchalaya is another example of appropriate technology. So these are the four important principles. One is equitable distribution, another is community participation, another is intersectoral coordination, and another is appropriate technology. Now, what are the elements of primary health care? Elements of primary health care. One is education about prevailing health problems and methods of preventing and controlling the health problem. So community people must be educated, particularly during rainy season, that you may have gastroenteritis if you do not drink safe drinking water. You may develop malaria, dengue if you do not use mosquito nets, particularly at the time of sleeping. So community people must be educated. You must you must clear your water containers at every week. At every week you must empty all the water container bottles and you again refill, because if there is stagnant water for more than 10 days, there is chance of breeding of the mosquitoes, and particularly the Aedes mosquito grow on small amount of water. That's why you clear all the utensils at an interval of 7 days, so as to prevent various vector-borne diseases like malaria, like dengue, chikungunya. So you educate the people about the common health problems and how to improve the health of the community. Next is supply of safe water and basic sanitation. You as a medical officer, it is not your responsibility to provide safe water. So it is the responsibility of the panchayat or the municipality or the corporation. So it is the duty of the panchayat or the municipality authorities to provide safe water and basic sanitation. you can motivate the people that you must have access to safe drinking water and facilities for basic sanitation. Next is food supply and proper nutrition. Food supply and proper nutrition. It is the responsibility of the agriculture department, food department to provide nutritious food so that child does not suffer from malnutrition. Third is, this is the third one, food supply and proper nutrition. Next is MCH care and family planning. MCH care. MCH care means care of the mother and children. Not only the antenatal care, but also the postnatal care, internatal care, and also the care of the children. Advice to the mother about exclusive breastfeeding, supplementary feeding, nutritious diet. So these are the MCH care. And family planning. Family planning services is also equally important, because if you do not give advice regarding family planning to a woman who has delivered a child, say 1 month back, so if she does not adopt any family planning measure, he may conceive after 3 or 4 months. So sufficient, if there is no sufficient gap in between 2 pregnancies, child may develop low birth weight, a low birth weight child may develop, and low birth weight children are more prone to various types of diseases, and also there is more chance of complications during delivery. So MCH care and family planning services are also equally important, and these services are rendered by the PSC medical officer and other staffs as a part of primary health care. Next is effective treatment of common diseases and injuries. Effective treatment. Effective treatment of common diseases. What are the common diseases? And injuries. Common diseases like ARI, diarrhea. ARI means acute respiratory tract infection. Diarrhea, common cough and cold, and treatment of common diseases. Patient needs few sutures. Patient needs dressing. So these are the common injuries that can be treated at PSC level. Treatment of snake bite cases. So these services are to be provided at PSC level. So effective treatment of common diseases and injuries. Next is kota holo? Immunization against major infectious diseases. What are the vaccinations or what are the vaccines which are given to an infant? What do you mean by fully immunized child? Fully immunized child. What is the meaning of fully immunized child? Anyone? Fully immunized child means all the vaccines which are due to a child below the age of 1 year. So, if an infant gets all the due vaccines within 1 year, we can say child is fully immunized. But if a child is not getting the measles vaccine, child is partially immunized. We will say partially immunized as the child did not get the measles vaccine. So, starting from BCG, Hep B, poliomyelitis, pentavalent vaccines, rotavirus vaccines, JE vaccines, including beta A solution. So, all these vaccines are to be provided at the age of, before the age of 1 year. Then and then only we can say that the child is fully immunized. Clear? So, these services are to be provided through PSC, that is immunization against major infectious diseases. Next is prevention and control of locally endemic diseases. Prevention and control of locally endemic diseases. What is endemic? What is endemic? Epidemiology পড়ানো হয়েছে? Epidemiology ক্লাস হয়েছে? Epidemiology ক্লাস হয়েছে? Yes or no? Endemic means constant presence of a disease in a locality. Constant presence of a disease in a locality. Example is diarrhea, gastroenteritis. So, these diarrhea cases are coming to the hospital for treatment off and on. But if there is upsurge of diarrhea cases, then it is outbreak. So, prevention and control of locally endemic diseases. These endemic diseases varies from place to place. In some places, malaria is more endemic. In some places, Kalajari is more endemic. So, prevention and control of locally endemic diseases. And supply of essential drugs. Supply of essential drugs. What are the essential drugs? The drugs which are needed to save the life of the patient. Suppose if a patient was brought at an emergency and patient is suffering from severe respiratory distress, immediately you have to give the oxygen. So, these are the important, this oxygen is important, and also if needed you can administer the steroid injection. So, steroid injection, it is an essential drug. Antidiarrheal drug, IV fluid, these are also essential drug, IV infusion. So, these essential drugs, suppose a patient is suffering from severe pain abdomen, so you have to give antispasmodic injection. So, these are the essential drugs. So, these essential drugs are to be supplied through primary health center and also the basic laboratory services. So, these are the important elements of primary health care. You may get long question, define primary health care, what are the principles of primary health care, give suitable examples, and what are the elements of primary health care. You just mention the important points of primary health care. No need of elaboration, just you mention the elements of primary health care. So, these important 8 points in World Health Assembly in 1977. In 1977, in World Health Assembly, it was resolved that every citizen should have a minimum standard of health, that is health for all. Minimum standard of health, that means health for all. Health for all means attainment of a level of health that will permit every citizen of our country to produce, to have economically productive life. Attainment of a level of health that will permit every citizen to produce economically productive life. So, this health for all is to be achieved by the year 2000, and Government of India as a signatory of this World Health Assembly, government adopted various national health policy. National health policy was adopted in the year 1983, so that our citizen can have a minimum standard of health. That means health for all by the year 2000. So, this goal of health for all can be achieved through primary healthcare approach. Through primary healthcare approach. And primary healthcare approach includes all these elements of primary healthcare. Clear? So, this health care approach, primary healthcare approach was adopted by Government of India, as Government of India was a signatory of World Health Assembly,